America's healthcare system is, in some cases, the most renowned in the world, and in some cases, some people say the most broken in the world. We spend the most money and have some of the most mediocre results of anywhere in the world, and we like our healthcare system, just ask us. There is some, we're going to talk today about healthcare fraud, and it's a relatively complex topic, and so I'm actually going to read my comments, and then we'll discuss it at the end, and but it's a big deal. The federal government, the state of Minnesota, seniors, health providers, and taxpayers have been taken for a ride, and we have to stop it. The Government Accountability Office and the Center for Public Integrity have revealed the largest potential case of medical payment fraud in United States history. Health insurance companies managing Medicare have overcharged the federal government by $20 to $70 billion over 5 years by reporting their patients are sicker than they actually are. Through a process called risk adjustment, companies get more money for patients who look like they are sicker than somebody else. The companies report the score, and the feds increase the rate. No comprehensive proof or review is required. The money comes whether they really are sicker or not. The government mandates that people buy insurance through these private entities, but no one is examining the legitimacy of the rates they are setting for themselves. These companies have been acting as our watchmen to guard the integrity of the program, but who is watching the watchmen? Risk adjustment overcharging could amount to $140 billion over a decade, or as much as 9% of the Medicare Advantage program. That's a lot, by the way. This is not new. We have seen symptoms at the state level for many years. It is only recently in Minnesota that we have learned that we have no auditable data or information regarding the operation of these programs. Now we are learning the same thing is true at the federal level. This has not happened by accident. Health insurance companies who should have been providing this information have intentionally withheld it. This has now spread from the state to federal programs and also threatens to add massive costs to the Affordable Care Act. If we are to avert the impending disaster in these vital government programs, it is time that we demand integrity and accountability in government and its vendors. The current rate of government spending is unsustainable. Many individuals fear for Medicare's long-term viability. If these deceitful and corrupt practices continue, they will bankrupt Medicare. All senior citizens have spent decades paying for Social Security and Medicare. It is both immoral and irresponsible to rob them of the programs and benefits they were promised. The insolvency of Medicaid and Medicare are threatened by this corruption. The Affordable Care Act will fall victim to these same deceitful practices. These problems could cripple the healthcare system, which represents 1/6 of our nation's economy. Immediate action is needed. The most concerning part of all is, although the media is talking about this, and thanks for being here today, our elected officials stand idle. What has Al Franken done about this? Nothing. And silent Mike McFadden has no understanding of this problem, nor does he have any experience in governing. One has to wonder how many government leaders have been bought off or scared off by these healthcare insurance companies. Newspapers have reported that politicians are being threatened with attack ads in this election year in the unlikely event that they have the courage to speak, let alone act on this issue. This is a big deal. Washington needs someone who understands the problem, knows how to solve it, and isn't afraid. I'm the only one. Franken has no interest, and McFadden doesn't have the knowledge or skills. I do. People know me to be knowledgeable, independent, and not afraid. I will do what is right in this case. If that means standing up to these corrupt insurance practices, I will do that. We have to ensure that seniors are not being cheated out of all the health care that they have paid for, and we have to protect taxpayers and the health care providers. This problem is real. It is a crisis. This is not only a question of middle-aged adults who are concerned about the long-term future of Medicare. It's also a problem for current seniors who may not get the benefits that they were promised and rely on. We need to act, and we need to act now. The most important first step is to demand transparency and accountability from government and the health insurance companies. The government must audit and verify the true cost of care, and then compare this against the representations made to them by the health insurers. This is a precaution that should have been made hundreds of billions of dollars ago. These health insurance companies have refused to disclose this data, claiming it's confidential and a trade secret. Healthcare programs that are paid for entirely by taxpayers can never be confidential or invoke trade secrets. Medicare fee-for-service discloses this information and publishes provider-specific cost data. That's how it should be. Managed healthcare public programs such as Medicare Advantage and prepaid medical assistance, our PMAP program, disclose none of this same information. Concealing this information practically guarantees victimization through fraud and abuse. This blatant theft from the government is sadly just the tip of the iceberg when it comes to ensuring that every dollar in Medicare and other public health care programs is well spent. It is no secret that our health care programs are a complicated tangle, and with plenty of waste throughout. This $140 billion is in addition to those other wasted dollars. Currently, our fraud prevention efforts touch only upon petty theft. It is time to go after the major thieves. Washington needs leadership on this issue. I can be that leader. I'll stand for questions.
Could you swing the microphone?
Oh, this. I'm sorry.
How would you want to launch this audit process?
Well, first you have to decide you want to. This is very controversial. I've been reading about this the last week or so. There's been a lot of press about it. Press, I'll remind you. Thank you for being here. But very little political commentary. First, you have to decide that you want to try to manage the government programs and actually make sure that they're viable for the long haul. The first step is to admit you're willing to do something. At this point, from the administration all the way through the elected officials, they're unwilling to do anything with the high pressure of with the extreme pressure from the health insurance companies and misapplied concerns about quality of care.
But your solution consists of the government would do an audit and there would be more disclosure. Is that, or give me the basics of what it is
Right.
that we're doing.
Well, first you would look and see. In Minnesota, when we do a total cost of care program with our accountable care organizations, we think that should cost less. Medicare Advantage in 2009 cost 14% more. What kind of deal is that? Medicare, you can go all you want to whomever you want as many times as you want. You go to the doctor and they take care of you. That costs a certain amount. Medicare Advantage costs 14% more. They get paid more because they do something called risk adjustment. A controversial program has been these home visits where they go to somebody's house. If your grandmother or somebody, they would go and evaluate her health history. Oh, you had cancer? Oh, okay, let's write that down. Are you discouraged sometimes? Oh, depression. All those numbers add up to a higher capitated rate for the health plan that they get the money. Whether the person is really sick or not, whether they actually incur any care. And so there's no incentive for the health company to actually deliver the care, as there is if you're, which is why you need the patients to be involved and some advocate perhaps. And so it's just set up to fail. And in Minnesota, like I said, we actually expect savings out of that, not increased costs. And so it's a scandal, and it's wrong. Medicare is supposed to go broke in 2028 or something like that. I don't remember the exact year, but coming up. And they're chasing a 24% provider cut year after year that they have to keep buying back. And when you're squandering funds in the Medicare program that should be put toward patient care, you're only helping to advance its own insolvency. This is a real problem.
Are you suggesting that Congress somehow compel these health care programs to share the data?
Yes.
Okay, and they would do that by authoring legislation?
Well, in any number of ways. I'm sure the president could give an executive order to make them do it, and CMS could require it. I don't know what laws need to be done. I don't have that level of detail, but we need to demand accountability. And as I read on the web, the elected officials are fleeing accountability by duress, I believe.
Do you have any evidence or concerns that this is happening among Minnesota-based health insurance companies?
The data isn't there. The data is more global and national. And so this is what we don't know. And so I'm not listing any names. There's names listed on the web about different groups that have been brought to task about this, one from Florida and some other ones. And so you got to keep honest companies honest, and you have to make them focus on the task. In 2011, we did some major reductions in spending in Minnesota, and no one got hurt. And the Democratic governor didn't change one penny when he could have, when he came back in 2013. We did that by focusing on the client. It's about the client, it's about the senior citizen, it's about the sick person. And you need doctors to provide the care, and the insurance companies are vendors, they're middlemen. It's not their task. It's not my task to make sure they become, that they become wealthy or even stay in business. I don't make it that money if they make $1, but they have to do the service to the clients.
So you're suggesting then that Congress somehow compel these insurance companies to share more information about how they're deciding these charges or rating these people. Do you have any concerns that would be perceived as sort of government overreach? I mean, we're already hearing a lot about how the federal government is way too involved in our healthcare system. How do you address that?
Well, it's probably a CMS issue. And CMS needs to do audits of these plans. They need to actually ask, why does it cost 14% more to do the same work? Is the quality of care better when you're spending 14% more? I'll tell you the system. I pulled this off the website from the CMS.gov. And so what happens is the Medicare Advantage plan collects data. They verify the data. They use a risk adjustment system to extract a score. And then their internal system processes it, and then the front-end system processes it, and then they store the clusters, and then they submit this data to CMS, and then the Medicare Advantage system calculates a rate and sends them the money. And at the most, they audit 25%. They've even said that they cannot, that it's prohibitive to audit all of these, and I respect that as a clinician myself. But if indeed Medicare is going to become insolvent, and if indeed we care about the welfare of our seniors, we have to address this. There is smoke everywhere on this topic, and the political figures are unwilling to address it, and that's what I'm calling attention to today, and to point out what kind of political figure I would be. I've spent my entire career in the 16 years here working with healthcare and entitlements and all that, and trying to get my arms around Medicare, and we couldn't touch it. Finally now, at the federal level, there's a chance to actually touch it. Somebody has to go who's brave enough to stand up to the health plans, the health insurance companies, and say, what are we buying for our money? Are you actually being good to our seniors, or are you just taking the money for your own shareholders? And that is not what the deal was. The deal was they will serve our seniors thoroughly and well, and not keep the money for themselves. That's what today is about.
Are you aware of the risk levels that the insurance companies use? There's standards on that. I understand there's pretty well accepted acuity standards in hospital care and that. Are they using the same metric on compensation, or does that need to be readjusted too? Well,
the audits have shown that for every 5 adjustments in a risk score, 4 were over-scored.
These are not standard measurements?
Well, it's all in the eye of the beholder. It's what you want to check. Which box do you want to check off? And then so they're doing home visits, which is a way to actually increase the acuity, is the term they use. And risk scoring is something that is throughout the Affordable Care Act as well. It's through Medicaid. When you do these accountable care organizations and give blocks of money to health plans and health insurance companies to serve people, it's all risk adjusted. But risk adjustment is an imperfect science. And if it's skewed toward help people who are doing the scoring to get the money, all we're doing is wasting money and taking it out of the system that it should be kept for the clients and the taxpayers.
But just so I understand, the GAO and the Center for Public Integrity, their role in this is they looked deeper into the patients and discovered that they were less sick than they were being reported. Is that how they come into this?
The GAO said they had the lower number that they found. They were the 20 billion over 5 years. But they found that there was inappropriate risk scoring going on to the tune of about $4 billion a year. And that's a pretty important group. And this other group, this Center for Public Integrity, found a higher number. They found $7 billion. They found $14 billion, or $70 billion over 5 years.
Because people were being reported as sicker than they actually
Right.
were. Okay.
And the money that went to the health plans, the health companies.
Are both these reports recent from the GAO and the Center for Public Integrity?
They're all over the web. Yeah, they're very recent.
They were
And
released recently, though?
and they're, the data is, so yes.
So would your contention be that the seniors are being made out to be sicker than they are so that the insurance companies can glean more money from Medicare?
Absolutely.
And then your solution would be?
Give them the right amount of money. And so, then put the savings back into the Medicare deficit and to make sure that people can get what they bargained for. Go ahead.
Is there a chance of getting the insurance companies to share that data?
They work for us. In 2011, I identified the health plans in Minnesota as being vendors. They were not used to being called vendors, but they are just simply a vendor. They're a middleman to provide a service. Now, nothing wrong with them. They're fine companies, but they're simply a vendor. And so when you hire a vendor to do a job, then the vendor has to do the job. And when it's state and federal money, they need to do their job as effectively as possible and focus on outcomes, not on their bottom line.
You know any place where have been sharing the data, the risk, the acuity, the risk assessment?
The data is only shared when they're required to. They never do it voluntarily.
Has any state or government agency done that? Required them to share the data?
In Medicare fee-for-service, which is all run by the feds, that data is shared and published. And so the Medicare Advantage programs that are private companies sequester that data for their own use. And so we think that should be released as well. Well, thank you for coming. It's good to have health talk once in a while, right? It's a very complex topic. Most don't understand it, but it affects us all, and it affects our future. That's why I'm here today. Thank you.
It's for the wounded campaign workers, is that it?
Been harmed by the conflict, we can...
Okay, you got paramedics along?
Oh, we're good. Yeah, we got a little... got some Band-Aids and some aspirin.
Okay, good.